I would like to introduce Dr. Lizelle Pierre-Romain, who has been with the Department of Public Health for the past 8 years. As well as being our practicum coordinator, she also teaches in our health policy track. She is Grenadian born and raised, and like most of her peers, left to study abroad. Her choice was in the UK. She worked with the NHS and studied health economics at City University London. Lizelle, as the practicum coordinator, gets to meet with all of our diverse students to facilitate to facilitate some very interesting practicum experiences. Of course, with the COVID-19 pandemic, things have been a little more challenging. However, our students got quite creative to produce some very relevant and informative products for their practicum. She will now highlight a few of those creative pieces. Back to you, Dr. Casey.
Thank you, Dr. Smith, for that introduction. Can everybody see me and hear me clearly?
Yep.
Yes. Okay, perfect. So it's not a video, unfortunately. You get to see my face for this presentation, and just permit me to share my screen. All right, can everyone see my screen? Right. All right, so really, we are talking about creativity in public health education, from the perspective of the student, right? We've been talking a bit about innovation with, the classes and how we were able to change that. But now we're looking at it from the perspective of students and with, doing their practicum and how they were able to, not only during COVID, but able to manage to provide some really interesting pieces for their practicum. So for this presentation, we're going to cover, it's probably going to be quite brief. We're going to look at what our practicum looks like, what our public health department's practicum look like. We're going to also try to navigate the virtual conference website so we can locate some of those some other practicum products that's on there. And also I'm going to be showcasing a few of our students' practicum products. So normally, outside of COVID, our practicum entailed students basically going at a site. In most public health schools and programs, that's what they generally do. Students get to choose whatever site they want to based on their career paths, based on what's available, and they actually do, it's basically work experience. So they choose their site. It is very student driven. Choose their activities that they're going to be doing along with their site supervisor, and then they would produce deliverables for that practicum experience. So once everything is approved, then obviously they can start. So as you can see on the right hand side, it's kind of a nice little cycle. It's approved site, you do your practicum deliverables. That's how it was before. I mean, it's still the same thing because we try to ensure that the students' competencies are met, public health competencies are met, or their track specific competencies are met with the practicum that they're actually going to do. It was a lot easier when, they had a really good site supervisor with a lot of years of experience to guide them on very different projects. Students got to experience going to the site. And I mean, nothing really beats that, right? And actually learning by doing. But now with COVID, we had to be a little bit more creative. We had to ensure that students were still, they're still able to demonstrate those competencies while they're on site. Sorry, not while on site, while they're doing their practicum, but also provide deliverables, practicum deliverables that are not just uploaded onto eValley, which is a system that we use, but we also try to ensure that this is something that is shared or viewed publicly, or there's a lot of engagement with the public with these practicum deliverables, right? So what I want to do is now, we have a project site for this conference website, and I'd like to just go through how you can access some of our projects, some of our practicum products on the project site. So when you go into the main the home screen of our conference website, you know, there are the tabs on the left, and you can select projects. And once you select projects, it will take you to another screen that has various different projects, policy briefs, practicum as well, other little videos that, you know, we try to provide for you as it relates to our conference and the theme of our conference. So all you need to do is just type in practicum in that search tab, and then you will see some of those products that are there. We are going to upload a little bit more for you so you can peruse the products that students have done for their practicum. So I'm just going to highlight just two of the products that students have produced for their practicum. Now, this first one was produced by a student, water sanitation and hygiene training manual. This was an initiative by the BNTF, which is a basic needs trust fund. This fund is basically was started by the Caribbean Development Bank, and it operates in a lot of different islands: Guyana, Dominica, Antigua, to name a few, and in Grenada. And what happens is that with the Caribbean Development Bank and with the governments of the countries that they're operating in, you know, they fund different projects, and their main aim is to reduce poverty through education, through human resource development, as well as, you know, water safety and sanitation. So this student was able to come up with, you know, by working with a lot of stakeholders, come up with a training manual. And that training manual, what apparently is now, will be adopted by the government of Grenada, because it was such a well-done product and well-researched product. The government of Grenada would actually use that when, you know, training Grenadians on water, sanitation, and hygiene. It was done specifically for the Grenadian adults. There's another WASH manual that was done for the children between ages 5 and 10, which is also really quite interesting. Of course, the language is going to be very different. And for this particular manual, she broke everything down. Well, she broke it down into 3 categories: water, sanitation, hygiene. And then she was able to compare what Grenada is doing, look at what the recommendations and the guidelines were, and basically look at the gaps, and was able to make recommendations, and also highlight a few learning activities for persons, you know, who are using the manual, you know, things that they can do to help, you know, engage with the whole, you know, learning process of the water, sanitation, and hygiene. So that was actually really quite interesting. She worked really hard on that. And because this, you know, now we have to be really creative with the products that the students are providing. You know, this manual, it being adopted by the government of Grenada, means that this is something that will be used, you know, in the future. I guess it will be updated as time goes by. And then also with COVID, you know, we are very keen now on hygiene and washing hands and cleaning and cleanliness. So I think it comes at a very good time for us, this manual. And this is just some excerpts of of what she did, some of the learning activities and assessments. But obviously, you can access the project through the project site, this manual, and you can have a read through it to see how, you know, how well done it was. And the final product I'm going to talk about is actually really quite interesting. There was a student. Now, this is a dual degree student. He's a medical student as well as an MPH student. And I think at the beginning of the year, he was supposed to start his clinical rotations, and COVID hit. You know, so out of frustration and out of lack of information on where he was located about COVID and stuff like that, he built from scratch a dashboard tracking COVID-19 in northern counties in the state of New York. So there were about 7 or so counties, and he was able to use information from, I guess, CDC, WHO, the New York State departments, to help populate you know, that website. And it's really quite informative. He has newsletters, he has current news, you know, everything as it relates to COVID cases. hospitalizations, recovery, so to speak. So it was really quite interesting that he was able to come up with that. Now, our students, because they're not being supervised by someone on site as they would if they were at a practicum site, we have our faculty to thank within the department for advisement. So the two products were advised by or supervised, sorry, by our faculty within this department. So I mean that is also quite impressive that we're able to provide, you know, such kind of interesting. We'll have those kinds of skill sets to be able to do that actually. So this is a little bit of from the site. Again, you can go onto the project's site on the conference website to view these products. There are other products as well. That there was a student who is a vet student, a dual degree, but he's a vet, and he did a PSA on salmonella prevention. And the idea of that came from the fact that people are not eating out anymore. You know, people are not going to restaurants because of COVID, so they were cooking at home, and there was an increase in salmonella. I guess people weren't cleaning their foods properly. So he put out a PSA on, you know, cleaning your meats and being aware that this could be something, you know, as a result of COVID. So what I've learned is that COVID is our new normal, as most of us have been saying. It's something that we have to get used to. It's not going to go away anytime soon. But I've also learned that our students are very resourceful and very creative and quite flexible. It's sad that they're put in that position, but the drive and the vibes I get from them, that they want to create their own thing, with relates to public health, and to be able to share it. I mean, there was a student who also did a website on, she was a vet student as well, on caring of your pet during COVID time as well. And the thing is, those things are very interactive. So the products are out there in the public. People are interacting with that product. For the same dashboard, comments were on the site saying that, you know what, I'm so thankful to the student that did the dashboard, because now, information is being shared, and I didn't know that was happening. So that engagement with the public is what we really, really, really appreciate, and really, I mean, we're glad to see coming out from these products. So this is all I have for today. Thank you very much. I have my email on here. That's if you want to get any more information on the products, if you would like to work with us in terms of, hosting students for their practicum. So my email is right there. Thank you so very much for your attention.